All right, and we're back. So, quick review about what we talked about the last 2 days. Brain controls the body, body controls function, function controls ease in the body. If you have a subluxation, which is a bone that goes out of place and puts pressure on a nerve, it can cause a degenerative process over a period of anywhere from 1 month to over 30 years before you start actually feeling the symptoms. Your body progresses through a series of events. Starting off, we have malfunction, which affects your nervous system over here, which we've talked about, and if you need a review on that, go back to the last 2 videos. Eventually you move into a state of dis-ease, and then finally we get into symptoms. Again, symptoms are the last thing to appear, usually the first thing to go away. Just because we got the symptom fixed does not necessarily mean that we've got all this fixed, and sometimes it takes a little bit of healing to get to that point. So that's what we're going to talk about today. First, I want to talk about the cause of the subluxation, then I want to talk about the healing phases. Okay, so what causes a subluxation? There are 3 causes. The first cause, make sure it was on the video, is a physical cause, and this is the one we're all most familiar with. This can start anywhere from the birthing process. The baby's pulled out by vacuum extraction or forceps, or just by manual pulling from the OBGYN. However this happens, it can usually happen at the birthing process. Then as we start learning how to walk, we're falling, we're bumping into things, kids fall off beds, they fall off couches. It's very important to have your kids checked. All 3 of my kids have been adjusted within 3 days of being born, and they maintain regular adjustments all through their lives. And rest assured, the adjustment for a child is much different than the adjustment for an adult. Other physical causes, contact sports, injuries with football, for example, or soccer, or car accidents, or any kind of a fall hitting your head. Any kind of trauma, any physical force that goes into the body can cause these. Okay, and it's also important to understand that once you have one, it does not go away unless it's removed by a chiropractor. Okay, so first one is physical. Second one, these are the causes of subluxation, the causes of these bones putting pressure on the nerve, and that can be chemical, poor diet, and physical also, poor posture can cause it. Chemical, poor diet, medication use, recreational drug use, physical toxins in the environment. Different things like these can cause reactions in your body that can actually cause these bones to shift out and start putting pressure on the nerves. And the third is emotional. And all 3 of these are very prevalent in our community, our society, but especially right now with emotional, we have stress. With the economy doing what it's doing, with not knowing where the government's going, with just everything. Our society is very, very stressful right now. Stress can cause these things to happen. So any one of these 3 things can cause a subluxation to happen. You get the subluxation, you begin the degenerative process. So how do you treat it? Well, you treat it using a chiropractic adjustment. Okay, how many adjustments do you need? That depends on your body, how your body responds, and how your body heals. And that's why the testing that we do to measure these levels of function in your body are very important, to make sure that we give you enough adjustments, but make sure that we also don't give you too many. Okay, your body goes through 4 healing phases. Okay, the first one, when you're down here in symptoms, is the relief phase. Now this phase, there's not much healing that occurs here. There's usually a lot of inflammation. Obviously the problem's been going on long enough that it's finally irritating these sensory nerves. So there's not a whole lot of healing that goes on here. But the goal of this phase, of course, is to get you relief, get you out of pain. The next phase of healing is what we call the corrective phase. And this is where the actual healing and recovery of tissue happens. Okay? The corrective phase is where we might start adding in some exercises or maybe some stretches or different things like that, and you actually start holding your adjustments for a little bit longer, and everything starts kind of going back into normal. Okay, once you've been in this phase long enough, and we run the tests that we need to run and figure out what phase you're in, next phase is what we call stabilization. Now this is the critical phase. If you had braces on your teeth, you know that, for myself, for example, I had them for about 2 years. About 6 months to a year into it, I started noticing my teeth correcting themselves. That was the corrective phase. If I pulled those braces off during that corrective phase, what would have happened? My teeth would have gone right back to where they were. Well, I kept them on long enough, and I got to the 1.5 year and 3/4 mark. I only had a few months left before I got them off. That's the stabilization phase. That's where you get things to where they need to stay where they are. Again, if I took those braces off then, I didn't think I needed them anymore. I didn't feel the soreness anymore. I didn't feel like things were moving anymore. So I didn't think I needed them anymore. But if I would have taken those braces off, I again would have returned right back where I was. Well, that's what the stabilization phase is to stabilize us, to get your spine in its normal position and get it as stable as possible. Once you have stabilized, then you get into what we call the maintenance or the wellness phase. And this is like the retainer that you wear after you get your braces on. It just helps maintain what you did. Well, the maintenance phase, that helps you maintain the corrections that you've gotten through all the care through all the care and all the exercise and all the different treatment plans that you've done to try to get this thing straightened out. So these are the phases of healing. Now, keep in mind when I'm showing this to you, this is not to say that everybody that comes into my office goes through this protocol and has to do this, okay? It's not what I'm saying. What I'm saying to you is that when you come in, I'm going to tell you exactly what you need and exactly what it's going to take to get you to that maintenance and wellness phase. But you're going to tell me what you want to do, all right? I never pressure patients into doing more than they want to do. If you're just here to get relief, I will give you relief and I'll see you next time when it flares up. I have no problem with that and I'll happily do that for you. If you're here to try to fix it, I'll happily get you up there as far as your body will let us go. So my job is to educate you on the best possible options. Your job is to tell me what you want to do with it. So keep that in mind while we're going through all this. So we talked about the causes, physical, chemical, and emotional, and actually how your body heals and what it takes to get that body through those healing phases. Now, how fast you're going to go through this is dependent on your body. Unfortunately, I don't have any control over that. Depends on what you do outside of the office, what lifestyle changes you make, and how healthy you are in general as to how quick you're going to heal. The younger you are, the sooner we catch these problems, you're going to heal much quicker than if you're older and these problems have been there for a while. Okay, tomorrow we're going to talk about the benefits of wellness care and how life is different if you've achieved that level, and then we'll move forward from there. All right, have a great day. We'll see you tomorrow.